Dr. Arroyo, there's a lot of screening going on at the booth on people's legs. Can you tell us what they're looking for, and not only when they, what symptoms you would have that would precipitate you having a test like that?
So what they're doing over there is an ankle to brachial index, which is a very simple test. They measure pressure, the blood pressure of your arm and the blood pressure of your ankle. If your arm is much higher than your ankle, that suggests that you might have peripheral vascular disease. The thing about peripheral vascular disease is it progresses very quickly, and about 50% of people do not have any symptoms. 50% of people will have symptoms like claudication, which is pain in the legs and the calves and the thighs when they walk. But like I said, 50% of the people will never have that and will develop disease that will lead to an amputation, and sometimes amputation of the limb is the first symptom. So the important thing to know about screening is that if you have the risk factors, you need to be screened. The two biggest risk factors are diabetes and smoking. So the current guidelines say that if you're 50 years or older and you have one of the two, you should have screening for peripheral vascular disease. Even if you're younger than that, if you're diabetic for more than 10 years or if you've been smoking for many years, you probably should get screening for peripheral vascular disease to avoid this disease leading to an amputation or to bad problems like that. The other screening that we have is the carotid ultrasound. All vascular beds are pretty much the same. It's very hard to have somebody with an artery with a problem, with a blockage or plaque in the leg, and not have it everywhere else. So it really represents the entire body. So when we do a carotid ultrasound screening, we look at the thickness of the carotid artery, and if we see plaque in the carotid artery, we can infer that there is going to be vascular disease everywhere else in the body. And then even if the person doesn't have any symptoms, we should look for symptoms and look at the other vascular beds to avoid events, again, like amputation, strokes, or heart attacks. So that's what we're doing at the booth over there.
And some of the screenings that we offer around the year at Health and Wellness and at different locations, they actually measure the intimal, the lining, the thickness of it. And we had one patient say their lining was measured and they were told you have, arteries the age of a 60-year-old. That was 2 years ago. They had it repeated this year. And their arteries, they say, were now measured for that of a 40-year-old. But they started taking, they lost 60 pounds. They started taking their lipid medicine. So there's some value in getting that screening to determine the health of the artery.
Absolutely. And, risk factor modification like weight loss and treating your cholesterol with statin medicines will have an impact in that everywhere in the body.